Perfect. So thank you for everybody for joining us. We really appreciate it. Tonight we're going to be hosting our alumni panel for the bachelor's and master's program in athletic training from Lock Haven. Really excited for this. So whether you're watching live or you're watching the recording, we appreciate your time and tuning in to watch this. And the goal here is to try to preview not only your potential experience at Lock Haven, right, but also the field of athletic training. You might be wondering, like, how do I know that this is the field I want to go into? If you're going to the health sciences, you have a lot of options. You could go PA school, PT school, med school. Like, you've got a lot of things you can do. We want to shine a spotlight on the field of athletic training as you're kind of in your decision-making process. So the event should take probably 30 or 40 minutes. We have a great group of alumni to join us. And we're going to run through some questions. We have some scripted questions, but if anybody who's watching live has anything that they want to learn a little more about specifically, please don't hesitate to drop that in the chat. Before we go any further, though, if we could start with some introductions, and I'll start us off. My name is Tom Kresh. I'm the Director of Graduate Admissions, and I will be your host for tonight. Thank you. Jasmine.
Hello, everyone. My name is Jasmine Lalim. I actually graduated from Lock Haven in 2017 and completed my master's program from Cal U in Rehab Sciences and Sports Psychology in the winter of 2018. I currently work at Shippensburg University.
Excellent. Thank you, Jasmine. And Derek.
Hi, everyone. I'm Derek Dragon. I completed my Bachelor's of Health Science at Lock Haven in 2019. And then I pursued my Master's of Athletic Training, graduating in 2021. And I'm currently working as an athletic trainer for Orthopedic Associates of Lancaster.
Awesome. Thanks, Derek. And Josh.
I'm Josh Moles. I graduated with my Bachelor's of AT in 17 as well. I finished my Master's of Sport and Exercise Psych in 18 at Lock Haven. Working as a GA there as well, and then now I'm going into year 6 as a guy senior AT in a traditional secondary school setting.
Mm-hmm. Great. Yeah, and so for anybody who's wondering, a GA is a graduate assistant. So that's a position on campus where you would work part-time at the university and you'd be a full-time graduate student. So it's a great position to have. There are a lot of GA positions across, Lock Haven and different CU campuses. So there's a lot to offer there. Great. Thanks, Josh. Rich.
Hello, everyone. My name is Rich Birdie. I graduated in 2013 with a bachelor's in athletic training, and then got my master's from Cal U in exercise physiology in 2014. I've been an athletic trainer for 10 years, mostly in the collegiate setting. Recently transitioned to the medical side of things. So I'm at Roth Orthopedics as a physician clinical assistant, and I've been there since May, really enjoying the transition from the traditional setting into a bit of an emergent setting in athletic training.
Sure. And Matt.
Hey everyone, my name is Matt Reebok. I graduated in 2015. I started out in the secondary setting and transitioned into the industrial setting in 2017, where I spent the last 6+ years working in various manufacturing facilities as well as theater and fine arts. I currently work for Select Physical Therapy in the central Pennsylvania region and travel primarily between York, Harrisburg, and Lancaster.
Awesome. Thanks, Matt. And Casey.
I'm Casey Creech. I just graduated from Lock Haven in 22. So I just finished my first full year as an athletic trainer at Countersport High School, which is through UPMC Cole in North Central Pennsylvania.
Awesome.
I finished the 2022 I finished the 3+2 program.
3+2. Okay. So man, right. Just graduated, brand new professional. Nice. So these, I think one of the more interesting things too here is you saw like just a wealth of different options that you have, the career options, right? So there are a lot of people who will graduate and go right into athletic training and be an athletic trainer. You might have some people who will graduate and apply the degree doing some different things. So first things first, could we just talk, learn more about your current career, your current role? Maybe could you walk us through a day in the life of your current position right now? And we can keep that same order and start with Jasmine.
So currently, depending on what part of the season we're in, if we're in like the preseason in the fall, It's pretty much 2-a-days with the sports that I work on our side of campus. I work with another athletic trainer. Her name is Tanya Miller. And we work with men and women's soccer, field hockey. We work with tennis. We work with lacrosse, softball. And so basically they go 2-a-days. We'll be there from maybe 7 o'clock in the morning, and then kind of go back to back with the 2-a-days for the sports. We'll get our lunch in at some point in there. And then once the day's over, we kind of go, about our day. That's just with practices. Once we actually get into the seasons and things like that, everybody's only practicing once a day. And some teams might have competition that day, so the day might be a little bit extended on the back end. But then they might all just be practicing, so then the days are shorter. So it definitely varies depending on, your week and, what all the teams that you're working at or with have going on in their schedules.
So Jasmine, are you assigned certain sports?
So we basically share them. Essentially, we both work out of the same office, and they just kind of rotate in and out. So let's say the first practice starts at 8 o'clock in the morning. We'll be in at 7, prepping water and prepping any of the athletes that need any of our attention. They'll go out at 8. One of us might stay in, the other one might go out to watch that first hour of practice, and then we're coming back in to the office for that second half of the practice, because then the next team is coming in. So we prep them, and as that team goes out, the other team is coming in, and we're kind of doing the post game or post practice treatment for them. And then once they're done, then the next team kind of comes and we filter out that way. Luckily, our offices are basically maybe 50 yards away from all of the fields that we work with. So all of the coaches have our numbers in case anything were to happen. And we can kind of go out there quickly. We try to, make sure we're moving around, but we don't necessarily stay at the practices consistently since it's so close. But we do go out as much as we can.
Great. Awesome. Thank you. Derek.
Okay. So my current role is a supervisor within my department. But I think probably talking about my initial role would probably be a little more applicable. So when I first started, just covering at Spooky Nook Sports Complex, for the most part, providing some outside coverage to some other small schools and stuff like that. Our department is relatively big. We have 25-ish full-time people and a bunch of PRN people that come in as needed. So we provide a lot of coverage to the Lancaster area. But the Spooky Nook Sports Complex, I don't know if you know, is the biggest sports complex in America, biggest indoor sports complex in America. We can hold up to 34 courts of basketball going on at one time. We've had 55 mats of wrestling, 40 or 50 courts of volleyball going at a time. So it can be pretty chaotic. During the week, it's normally just a evening shift covering adult rec sports and covering the fitness center where people work out. And then weekends, it can be a little bit of a madhouse with 20,000 people there on a somewhat regular basis. So yeah.
So what I'm picturing the venue that you run, Derek, is this kind of like the Mall of America, but for athletic venues almost, like probably that size.
Yeah. So like we've had times where we've had 30 courts of basketball going on. So we have like 4 or 5 people dedicated to covering that. But then we'll also have a gymnastics event going on in another part of the building. And we'll have soccer games going on outside or a lacrosse game going on outside. So, or field hockey at one too. So, I mean, there's been times where we've had 15 people working on site at a time just to kind of cover all the events that are going on.
Yeah.
And
your current role is what?
The supervisor for athletic training there.
Supervisor for athletic, but prior to that, you were an athletic trainer, I take it.
Yeah, so I still work as an athletic trainer. It's just that now I have more time behind a computer sometimes. But for the most part, like I still work most weekends covering events and stuff like that to kind of fill out the rest of my hours.
Awesome. That sounds really exciting. Josh.
Definitely not.
Oh, I'm
boring.
sorry. Yeah, go ahead. Yeah, I was going to say, I cannot imagine that you have a lot of free time.
No.
Josh.
So I am contracted to Geisinger for the last 6 years. I spent my first 3 at a secondary school in Central PA called Chickalemi,
Mhm.
right by Stevens Grove there, and then spent 3 years there. And then the last 2 I've been contracted to. It's a new combined high school in Wilkes-Barre area. So
Okay.
we graduate around, I think this year was around 500 to 600 kids for one class. So I work with 2 other athletic trainers full time there, and we all work what's called a split appointment. So
Mhm.
our mornings are clinical settings, and that could be in various areas. I used to work as a orthotic fitter for bracing departments, post ops, things like that. When I was down in Danville, that was inpatient, so post op, ACL, things like that. And then the last 2 years have been more outpatient orthopedics, the typical things you would see with surgical doctors and things like that. And then our afternoons would be, you would roughly go to your school around 1, 2 o'clock. School gets out at 3-ish. And then for our site, because we are a little bit spread out over the city, we currently have 3 different athletic training rooms. So during fall seasons, I primarily work with the football teams, so 7 through 12 football, which can be a lot in itself. And then the other 2 that I work with, Megan and Kayleen, they'll split soccer's and field hockey's up and down, and we manage, girls volleyball, cheerleading, things like that throughout
Yeah.
fall season. So I primarily do all contacts, so football, wrestling, and boys lacrosse during those years. And then it's basically a hodgepodge of everybody trying to figure everything out because the school was
Mhm.
built 2 years ago, so
Oh,
everybody's trying to figure out their role within that building.
yeah.
So it's been a little bit of a transition
Mhm.
compared to where I was a second AT at that Chickalamy school, where Mike Elder has been that AT there for, I think he's going on year 24. So a little
Mhm.
bit of established there to a new, like, you're trying to make everything into a figured out role in this
Sure.
new school. So it's been a challenge, but it's been fun.
So Josh, when you talk about at the very beginning, you mentioned that you're working, you part of your role might be working in more of a clinical setting. What are some of the things you're doing when you say like you're in a clinical setting? Like what are some of the tasks?
So clinical setting as a Geisinger contracted AT,
Yeah.
it can be a little bit different avenues. We have clinical help, so somebody can be a scribe for a doctor. We've had 2
Mhm.
that work there. Some have worked in podiatry doing that, orthopedics. Some people will room the patient. They'll do all the initial
Mhm.
screens, height, weights, things like that. I worked in the orthotic field because that was their need when I joined. So I started doing off the shelf bracing for their outpatients in orthopedics, and then I eventually moved into the inpatient because there was a need there. So I would spend most of my mornings in hospital settings. So I would
Yeah.
go to the big Danville hospital. I would work in like the trauma ICU, or could have been pediatric ICU. So I would see anything from, like, a 10-year-old getting their knee surgery for whatever reason, and then I could be upstairs and we saw motorcycle accidents that day. So
Sure.
uh,
Oh, wow.
primarily there were, like, refitting cervical collars and back braces and things like that.
Okay. Wow. Yeah. Just wearing a lot of different hats, seems like.
Yeah. So in doing that orthotic role, they've been expanding up here in the Northeast. So doing orthotics wise, I've been in about 8 clinics doing that kind of stuff, from
Yeah.
anywhere from Danville to Lock Haven to Scranton. So we've been a little bit
Mhm.
everywhere.
Sure. Great. Thanks. Rich.
Yeah, so I'm gonna take this question a little bit in both ways, since I've been an athletic trainer in the college setting for 10 years. I'm gonna give a little vision of what that was like, and then into my new position, which is not in the traditional setting any longer. So when I was in the college setting, I primarily specialized in men's basketball. So it was a little bit different. I only had to specialize in one sport, take care of, 15 to 20 guys. And that was my main priority. So my job was really being responsible for the day-to-day healthcare of each one of those athletes. And when I did, it was at the Division I level, so there's a lot of expectations. There's a lot of pressure from other people. Winning is the name of the game at that level. So in a typical day, I would get there around 7 a.m. From 7 to 8, we would do rehabs. So anytime of long-term rehabilitation for injuries, we would do that. And then most of the time, the guys would go down to lift with strength and conditioning. They would do that till about 9. And then after that, they would come back up. We'd get them ready for practice, whether that's taping, whether that's any type of like pre-practice stretching, warming up. And then from 9:30 to 12, that was our practice block. And then after that, they usually showered. Hopefully they did. Came back and saw me if they needed to, and got their post-practice treatment, and then finished up with just some administration duties. Finish up usually around 3 o'clock. So day to day, you're looking probably at like 7 to 3. Somewhere in that ballpark. Responsible for going on away trips. Responsible for every practice, communicating with doctors, physical therapists, anything you could think of, basically of managing that healthcare team. I was the person to go to. Been able to go to some pretty cool places. I've been to Duke University. Worked in the ACC for a short stint, and then I was able to go to Europe 3 times. So that was pretty cool. All paid for. So that was nice. Those are the perks of the job. You may not have a life, but there's some perks at the end of the tunnel. And then to transition to my current role, currently where I'm at in my life, I was looking for more work-life balance. So I made the transition to the orthopedic setting, where I am responsible for basically being a clinical assistant for my sports medicine physician. He's a non-op physician, so we're in the office 5 days a week. We see patients from 7:30 to 3:30. So I normally get there around 7 a.m. Prep the schedule, so basically print out all of our sheets, make sure I know what's going on throughout the day, what people need, whether it's a certain type of injection that they may need, whether it's an MRI that they're going to be reviewing, whether they need x-rays for the appointment, that type of thing. So just basically organizing and administrating the physician's schedule, and then just basically handling his practice, just making sure I'm answering phone calls from patients. If the patient needs anything, we just try to really help them out, scheduling, things like that, height, weight, blood pressure, doing a history with the patient when we're in the exam room. I feel that the physicians really like athletic trainers in the orthopedic setting, because we have such a vast knowledge of the anatomy and in the orthopedic setting. I really feel that we're valued there, and I think we're starting to really track in a good way in that setting, especially with our licensure act in Pennsylvania. I think that's really going to allow athletic trainers to really increase their scope in this setting.
So Rich, can you expand on that when you say the act that you just referenced?
Yeah, so currently athletic trainers are technically only allowed to practice with physically active people or population. So they're currently trying to transition or change the language of the act to just allow us to practice on more than just the physically active population.
Yeah, that's really interesting too, and it would open up a lot of opportunities and provide need, right? I mean, there's just a huge shortage of clinicians in general, right? Which is why, you're seeing fields like physician assistant and nurse practitioner and all these other roles that, years and years and years ago might not have existed or were very different, right? So that you can see the nature of these fields are starting to change. That's really, really interesting too. A good thing to keep in mind for people who are, just getting into athletic training is that you're gonna have a lot of options, right? Because normally what you're probably used to seeing is like the person on the sidelines. Right. In more traditional athletic training settings. However, like this field of sports medicine is just huge, right? And with that umbrella getting bigger and bigger, it creates more opportunity. And I think Rich and Derek, and I mean, you guys are both engaged in roles right now that are probably, 10 years ago, 20 years ago, might have been more non-traditional for someone with an athletic training background. Yeah, that's really cool. Matt.
Yeah, so my current title is an injury prevention specialist with Select Physical Therapy's Work Strategies division. So a little bit what I do on a day-to-day basis depends on the day of the week, but on average, my shift is usually 8 to 4 o'clock. sometimes earlier, sometimes later, depending on what the needs are and the facility I'm at. So right now I'm at primarily 3 to 4 different locations a week, basically serving as a contractor. And I've been doing that for about a year now. Prior to that, I worked at one site specifically, 40 hours a week. So my role there was a little bit different. I handled all injury care management for any occupational injury. That meant setting up doctor's visits if need be, any first aid treatment we could provide. And working in the occupational setting, it's a little bit different to what we can and can't do as athletic trainers. Because when you're dealing with occupational, you're dealing with OSHA. OSHA has certain regulations you can and can't do until a certain point is reached in that injury's timeline. So it's a lot of massage modalities such as heat and ice, NSAIDs, coaching on proper ergonomic form, and just general stretching. And then once it is deemed a recordable injury, I'm not going to spend too much time because I could talk about that for an hour. But once it's deemed that, then really it's already deemed recordable. We can treat it as a normal athletic injury and go from there, provide a little bit more therapeutic exercise, more interventions that you would see in a typical athletic training setting with a typical sports team. So really in that position, I was doing a lot of wellness coaching as well. So lifestyle management, nutritional counseling, because they're not necessarily athletic per se, but they are using their bodies to perform a physical task for work for 8 hours a day. Currently, kind of doing similar stuff with Select. However, I'm doing a lot more preventative measures. So doing a lot of job risk analysis, job task analysis, workstation analysis. So looking at a lot of ergonomics. So that was a big thing with having biomechanics as an undergrad. Really coming into play with my current job setting. And with this work strategies team, I'm currently providing some coverage at one of the local theaters in central Pennsylvania. They do live plays 2 times a day. So that is more my traditional setting where we have people coming in with athletic injuries, kind of like you would for a sports situation. They got hurt during their last production, or they need some tape applied, yada yada yada. So I get a little bit of that while also doing a little bit more preventative stuff for these other sites. Do you have any specific questions about that? It's more the industrial, we call it the industrial athletic training, not the traditional setting where you are working at a high school or collegiate university.
Yeah, no, that's really interesting though. Again, just for someone who's an outsider to this, I find all this really fascinating. That's great. Casey.
So with 2-a-days coming up in the fall, that'll look very similar, even though I'm at a high school, it look very similar to what Jasmine described with just being there for practices. Our practices will start at like 7 or 8 usually in the morning. So typically the only sports that will do 2-a-days will be soccer and football for me. But they practice at different locations, usually about the same time. So then, lunch break, and then I'll do like documentation if I need to in between any other paperwork. And then the evening practice. Once the season kind of starts, because I'm covering all of the sports, I usually have a game almost every night. Okay. So my typical work schedule is like 1 or 2 till the end of the game or whatever. So like 2 to 10 for sure on football nights. But
yeah.
As far as, so once winter comes, sometimes those work weeks will be I'll be a little low on hours. I won't get quite 40 hours at the school just because of what our contract is with the school. So there might be a couple days of the week that I'll go in and work as a physical therapy aide, just like cleaning tables and stuff in the mornings before I go into the school in the afternoon.
Interesting. Yeah, that's so again, for anyone who's watching it, you're getting just like a really interesting cross section of some of the different options that you have here with the degree in this field. So now for all of you, again, you have a degree in health sciences, right? You might be health science, might be in athletic training. How did you make the decision to go into athletic training, right? Again, like I said at the beginning, you could have done a lot of different things with this field or with that degree. You could have gone in any number of different directions, but you chose athletic training. Why is that, Jasmine?
Funny enough, I actually went to Lock Haven looking to pursue a physical therapy degree. And I just found that I knew I could learn the information, but it just wasn't hands-on enough for me. Like I wanted something that I could feel myself learning something, not just sitting at my desk looking at a book to learn and then not really getting any hands-on experience until after going into a master's degree or a doctorate degree. So actually my junior year of college, I took my first intro to athletic training course with Steve Streeter. And after that course, I was like, yeah, even if I have to do an extra year, I want to look into getting this because I felt like I learned more during that one course than I did my previous 2.5 years at Lock Haven doing all of the, prerequisite courses there. So changed my major. I reached out to Eric Lippincott to see what it was that I had to do to apply to get into the program. I made sure I had all my courses completed and then applied to the program, got in, and my cohort, which I actually graduated with Josh. I think we were maybe 15 of us. And yeah, it's the rest is history.
So
Rest is
I think
history.
we started with 17 and ended with 16.
Okay, yeah.
Nice. No, very cool. Great. Thank you, Jasmine. Derek.
Kind of similar to Jasmine. I was very interested in physical therapy. I got hurt once or twice in high school wrestling and ran into a PT at the gym that I was working out at. And I said, oh, like he helped me. Like, surely, like, this is what I want to do. And then I did some shadowing experience in physical therapy, and I was so bored all 300 hours that I was sitting there.
Yeah.
I felt like everything was slow paced, and a lot of people just didn't want to get healthy again. It was mind numbing, and I didn't enjoy it. I felt like I wasn't being pushed. So I talked to Steve and Eric, and I was like, do I go to PTA school so I can, not have to go to school for 3 years to do something I'm not going to like? And they mentioned, well, why don't you just get a master's degree for the same amount of school and you'll make more money. I said, oh, that sounds a lot better. And I obviously, wrestled my whole life. I was around athletic trainers my whole life, and I thought, oh, that'll be pretty fun. And honestly, I've loved almost every second of it. There's been some times where it's been a bit much, but for the most part, it's been overall a great experience.
Great. Yeah. And that is kind of what I was expecting to hear to a certain degree. It's like, oh, I was exposed to athletic training because I was an athlete and I spent time in the training room. Right. And that, I would imagine that's one of the more common on ramps. But that's really interesting too, where again, I could see that there's, as you're looking at the Venn diagram of like an athletic trainer and a PT, there's probably some middle ground there. But, Derek, based on your experience, how were those two professions different? It sounds like maybe athletic training is maybe a little more hands-on and you're working with a different audience or a different group of people.
I think that as we were talking before, a lot of us are athletes. We expect the people that we're working with to want to get better. And It was very disheartening how in the physical therapy realm, there seems to be a certain percentage of people that just don't want to pursue that goal. They want to just stay in the condition that they're at. And I find that most of the athletes, granted, there's always going to be some that don't really care that much, but most of them, especially the higher end ones, will always want to get back to doing what they were doing.
Yeah.
And I feel like it's more rewarding to help the people that want to get better and interact with people that want to get better than the population that chooses not that path.
Sure. No, that's interesting. Okay, great. Thank you. Josh.
Yeah. So, what was the question again?
Yeah, no, that's okay. So athletic training. So you chose athletic training over
Oh.
some of your other options in the health sciences.
So
YAT.
adversely to the other two, I never had this was my first option, my only option.
Oh, okay.
It happened the traditional way. I was an athlete. I got hurt my junior year, and I spent the next 9 months of my junior year with my AT, rehabbing an ACL injury. So I was actually his first reconstruction rehab. So we spent a lot of time back and forth with our philosophies of rehab, and that was a very, I guess, impressioning part of my life, because that was like at 17, I knew exactly what I wanted to do. Never really had another option or another thought in my head, but I was like, if this doesn't go well, we'll do something else. So it was very much, his name is Adam. It was very much me and Adam when I was 17, back and forth. We had, very some strong verbal matches at one point, when we don't feel like we want to do rehab. But seeing that now, being on the other end, it is very much the same way, where it's like, I know this is good for you, and this is good for you, but nobody wants to do it. But everybody, you see when in that athletic population and where I work in that high school setting, those kids are always just questioning you, and they're trying to push your buttons, but you're also trying to push them in the correct direction. So I, as Derek said too, it's a little bit more rewarding. You feel a bit more accomplished. You can see, like, from start to finish. You saw them at their best. You saw them at the lowest point that they may have been at their whole career so far. So, and to see them get back, that gives you a sense of, like, I know what I'm doing here. Like, this isn't something that is, we just don't stumble into this kind of profession.
Yeah.
So it is very rewarding in that aspect. And I never look back, and I still have no plan to. Seeing where the professionals I've seen, and just the people I worked with, I've seen, like, I worked a season in semi-professional hockey with the Penguins. So I've seen that kind of aspect of a pro career and how they are treated and how people are treated. I've worked in the collegiate setting for that 1 year of the GA. I've seen how they work, and I'm in the traditional high school setting. I've always kind of, I guess, liked it more in that kind of setting. It was a little bit more, I wouldn't say easier, but you weren't their therapist, their mom, their home away from home. So traditional settings, they can go home and they can get, the nurturing they need from their parents as well. But like even what Birdie said, the transition of work-life balance, it's a little bit easier in that traditional setting.
Sure.
So I never really had a look back from where I started at 17.
Yeah. That's awesome. Yeah, again, there's probably not a ton of people out there that know, hey, I've wanted to do this one career my whole life. But for those people that are like that, I'm always very envious. Like, oh man, like, what you want to do for the rest of your life is one of the biggest questions you have to answer as a human being. And for, like, those people that it's just like it was just delivered to them from on high. It's like, no, you're going to do this. It's like, oh man, those people are so lucky. I'm so trying to figure out what
especially
I would
at a high school age. They tell you, you need to go to college, and it's like, well, what am I going to do there?
Right.
And, you go through your first year, you have I remember at Lock Haven, you had like your first year seminar, and it was like, the average college student changes their major.
Yeah.
What?
multiple
7
times.
times?
Yeah.
It was something at that point. So it was like, in my head, I was like, well, I don't think I have another option when I was in that time.
Yeah, no, that's awesome. Rich.
Yeah, so ironically enough, my high school athletic trainer had 2 intro to sports medicine classes.
Oh, really?
Yeah, so I got injured my freshman year of basketball and met the athletic trainer. His name was Magic. He's been there for like 30 years at that point. My high school was known for producing a lot of good athletic trainers. I worked with the Vikings, the Eagles, several other professional teams, so they were kind of known for that because of him. So he had 2 intro to sports medicine classes, intro to sports med 1 and then intro to sports med 2. After sports med 1, I really enjoyed the intertwinement of sports and the medical field. So that's really what I was looking for. Trying to combine those two. I love sports, and I also wanted to practice as a medical professional. So that's something that I really enjoyed. And then not a lot of people know this, but I went to Westchester University originally.
Heard of it. Sounds familiar.
And I wasn't able to get into their athletic training program until I was a junior. So at that point, I was looking at 2 other schools. It was Lock Haven and East Stroudsburg, and I reached out to Dr. Lippincott, and he said, "Yeah, we'd be happy to have you." Put me in some anatomy and physiology classes, and got me in that next semester. So the second semester of my freshman year, I transferred into Lock Haven, and I didn't look back since. The faculty that I met, still to this day, we talk. Dr. Russell was my faculty advisor, helped me out so much, and really enjoyed Lock Haven University and wouldn't change anything.
Awesome. Great. Matt.
Yeah, so in high school, I originally thought of going to become a pharmacist. That changed once I actually shadowed a pharmacist for a day and realized I did not really care for what they did. I wanted to do something more hands-on. So originally I wanted to go into physical therapy. So that's what brought me to Lock Haven. And then through an admission fumble or something like that, I ended up coming in undeclared. So my first semester freshman year, being undeclared, I had the option to look at other options. And I thought it would be a great idea to get my undergrad in athletic training. That would be a extra plus on my resume going to PT school. So I went through the program with the idea that I would go on to PT school. But however, that wasn't in the writing for me. I ended up sticking with athletic training, and I am thankful for that. So I am taking my route a little bit different. I didn't really want to do the secondary setting for too long. I wanted to kind of deal with more adult population,
Sure.
And have a little bit more of a work-life balance. So I got into the industrial setting through one of my actual classmates who showed me a job offer, and I haven't looked back since. So I am so grateful for the faculty at Lock Haven, Dr. Russell, Lippincott, Steve Streeter, Mike Porter, all of them, Yvette, so much knowledge there, and I absorbed as much as I could. And one thing about Lock Haven is when you're in the professional setting, you're going to run into a Lock Haven grad somewhere else. We're everywhere. You're traveling out of state, you're going to run into a Lock Haven grad. Different settings, there's Lock Haven grads. We're all around, and it's definitely recognized as one of the premier athletic training schools. Yeah. Definitely in the state, if not the nation.
Yeah, there's no question. This is one of the things that Lock Haven or CU Lock Haven is most well known for. Yeah, without a doubt. This is, again, puts one of the reasons that put Lock Haven on the map is because of the program. This is something that's like one of the tentpole programs of the university. So I completely agree. Yeah. Casey.
Sorry, my internet, I think, is being a little choppy. So
No,
hopefully
it's
you can
okay.
hear me.
We can. Yep.
Okay. So kind of like most of us, I majored in high school. However, my athlete was mostly absent, and when she was there, it wasn't necessarily a good fit. So I chose athletic training, partially because I didn't be in the same setting like hospital or office all the time, but also because my high school, I said, needed a good athletic trainer. So here we are.
Short and succinct. No, that works. And again, no, that's again just kind of goes to show you that there's a lot of different ways to end up in the world of athletic training. So as we talked about your profession, we talked about how you got into this area. Can I want to dive a little bit deeper into your experience in at Lock Haven. So can you walk us through what a day in the life was like as a athletic training student? I know some of you went for the bachelor, some of you went for the master's, and some of you went for both the bachelor's and the master's. What was your experience like? What were some of the things that stick out to you most if you had to pick a couple? Jasmine.
The biggest thing for me that I've said since the beginning, and will continue to say, is not only the professors, but the graduate assistants that I personally have worked under. They always let us do basically everything. They weren't trying to micromanage us. They allowed us to make mistakes while still, being there to help us at times that we needed. We were able to develop all those relationships with the athletes as students. And they were very big on, if you don't know the answer, go figure it out. And if you can't figure it out, then we'll help you. But they weren't spoon feeding us. They were making sure that we were not only getting the hands-on experience, but also making sure that we were able to use our resources outside of getting the direct answer from someone. So I think that's something that has helped me along the way in all the aspects of athletic training. So, yeah.
That's great. Thank you. Derek.
Oh, the day-to-day of Lock Haven. It feels like it's been so long. It's only been 2
Walk
years.
down memory lane.
Yeah. Yeah, I think, I'm assuming the way that the master's program approached it was very similar to how the bachelor's was, just in a little bit of a shortened time frame. Wake up, you go to classes from like 9 to 2 or 9 to 3, whatever it is, and then you go to your clinicals for practice for the first year and a half, and then you go to your full immersion. But I think probably the biggest part of the day-to-day and what I miss is not only like my classmates, because we really developed a friendship, we still talk all the time, but the professors and the rest of the staff that's there, you can literally just walk in and talk to everyone. I was in Lock Haven last fall, and I stopped in. I saw Jody, I saw Mike, I saw Steve, and we were catching up like I was just there, like I was still another student. Like they still take an interest in you, and I think that's probably, at least that's what I miss the most. I mean, I went to Lock Haven for 6 years of my life, so I spent a quarter of my life in that little city. So it's the day-to-day though was, I think, pretty standard, but it was every part of it was enjoyable.
The best 6 years of your life.
It was, aside from those years I was wrestling, yeah, it was it wasn't always fun wrestling, but yeah.
Yeah, I gotcha. Thanks. Josh.
Yeah, day to day. I remember when it was still bachelor's, everybody was on a little bit of a different curriculum depending on what year you were. But my year, I think we were like 2 weeks into the semester freshman year, and we had a 2-week rotation. And I think Bertie was my GA, and Matt was the third year student at cross country meet, and we had to follow the last person behind to make sure that nobody was left behind across the river there. So it wasn't like you took your 2 weeks or your first 2 years of class or anything like that before you saw anything. It was like you were in there 2 weeks, you just unpacked your bags, and it was like, all right, well, you're across the river with another sports team. So it was very much a jump in and swim. So I like that. I'm more of a visual learner than I ever was a behind the desk learner. So being interactive with them, and like Jazzy, to add to Jazzy what she said, it was very much like, what do you want to know and what do you want to learn, and we'll do it right then and there. It wasn't like don't. There was never any like. It was never a bother. It was more of a, if you want to learn something, I'm more open to it. But if you're not going to ask me anything, I'm not going to tell it to you. So it was more of, if you want to engage, we'll engage as much as we can and as much as you want, but I'm never going to, force this upon you. And I really enjoyed that aspect of it, where it was, you had to use your critical thinking skills, or, if something didn't quite seem right or why, it was more of ask and then they'll tell you maybe, but it was more so you had to figure that out.
Yeah, you're treated like a colleague, and that's one of the
Oh, yeah.
differences between, an undergrad experience and a grad experience is, when you're a graduate student, you're treated as a colleague, as a peer. And there's higher levels of expectation. Yeah, for sure. That's a great point, Josh. I appreciate that. Rich.
Yeah, so I was I did my bachelor's at Lock Haven, then I did a grad assistantship at Lock Haven as well. So I kind of saw it on both sides, one from the grad assistant view and then one from being a bachelor's and athletic training student. So bachelor's, I did football and wrestling as my clinical rotations. So those are very time demanding, in addition to doing, your classes and everything like that. I was expected to be at football practices whenever they were, early in the morning, late at night, whenever that may be. And then with wrestling, that was basically from, September until March. So that was a long season as well. So Derek, I felt your pain for 1 year. And then, I really enjoyed my GAs, my preceptors. I always took it as your experience is what you put into it. So that's kind of how I went about it when I was a student, and that's how I taught it when I was a GA as well. So those students that were with me, if they wanted to put in extra time, if they wanted to do things, they did things. If they were, they were able to do those things. And if they didn't, they kind of sat in the side. Then that's kind of how I migrated towards the ones that wanted to do things, because that's who you develop trust with, and that's who you want to, eventually impart your experiences and your wealth of knowledge and things like that. So, when I transitioned to the grad assistantship, it was definitely a big transition, going from an undergraduate and then literally a couple months later, you're somebody's supervisor. So it was a great learning experience, and I cherish those memories. Like Matt and Josh said, we were at the cross country meets. I remember we had the Gator boys. They would ride in the Gator behind our racers, and then we would be at the finish line. So, those are the memories that we have. And it was always a great experience, and happy to help out. And Lock Haven's a great town.
Yeah, it seems to be a pretty close-knit group. I think probably around between 15 and 20 new students start every year in the master's program and at Lock Haven. So you get to know each other pretty well, right? I mean, you're going to spend a lot of time together. And even for the students who are starting as a bachelor's, as bachelor students or, pursuing your undergrad degree, again, it's a smaller group of students. It's not like, some of the bigger majors out there that might be 150 new students in that program. That's not how this is. So you're going to get to know everyone pretty well. And that group tends to function like a team. So it works really well for people who are, athletes or involved in extracurricular activities and enjoy that team aspect. And you're going to start grad school. You're going to start, your experience as an undergraduate with this small community of people who you are already going to get to know pretty well. So really kind of helps aid that transition from high school to college and from college to your grad school experience. Yeah, that's great. Matt.
Yeah, so when I was at Lock Haven, my class was the last class to have 5 semesters of the professional program as their undergrad. I think Josh might have been part of the first or second class that had 4 semesters. So it was a little different starting as a second semester sophomore, getting right into a professional program. So that was kind of unique to Lock Haven. A lot of places you had to wait till you were a junior or, even later to get your hands on and do things. Even as a level 1, which would be like a freshman entry level student, you were allowed to, participate with different activities going on with the teams that you were assigned, your rotations. So I did have a rotation with Rich and as my grad assistant. And Josh was one of, I think you were a level 1 at the time. But I do have a picture somewhere of the Gator Boy squad somewhere on my phone going back. But one thing that really sticks out to me is family. You enter the program as a group, you go through the program as a group, And graduation, after graduation, you go a whole bunch of different routes, different fields, different states, different parts of life. And but you're still family at the end of the day. And I think Lock Haven really has that family tradition within their program. And you don't really have that. From what I've interacted with other professionals from different universities, you don't really have that as much at different locations, different programs. So Lock Haven really strides itself on the family and tradition, and I think they really uphold that to the highest honor.
Yeah, for sure. And it makes your experience, like your academic experience, so much more enjoyable. Because right now, for those of you who are prospective high school students or your prospective college students, like you have your group of friends, right? Like what that's like. So imagine having to go through high school or go through college without those group of people. Right. That's kind of what it would be like if grad school was anything but like what Matt had just described. It can be a little intimidating. It's probably not as enjoyable, but being that you're going through this in a cohort model and you're going to get to know everybody really well, you're going to have a lot of the same classes, a lot of the same, clinical experiences. It's going to really enrich your experience and help you enjoy it more. Casey.
So I started the master's program of COVID. So that was the experience. There were a lot of changes on so many different levels.
Yeah.
Our clinical was planned, but flexibility and just like the ease of all of those transitions with the help of professors was amazing. Yeah, just like the family that you get being part of the program was amazing. And the professors are not to give yet. And I think that's one of the strengths. I guess that's kind of not answering your question, but but that's one of the strengths of the program.
No, and I think that's a good point too, because I can remember Dr. Lippincott saying at one point that on their faculty team, they have former athletic trainers, they have physical therapists, they have people with a very wide variety of academic backgrounds. So it gives you different perspective. Whereas if it was 6 faculty, all had the same PhD, all had the same professional clinical experience, again, you're only going to get one perspective. Whereas with the Lock Haven faculty right now is, again, they all come from different walks of life with different academic backgrounds. So it's a really, fulfilling experience. It's a good point. So we'll do some rapid fire questions here. I see we're coming up on an hour here. So if you had to pick your favorite class, you get one, right? Favorite class, why? Jasmine.
Dang, rapid fire number first one. Okay. I think the eval classes were my favorite because that's kind of where you were putting everything together. You were basically putting your anatomy and your critical thinking skills together to correctly put together an eval and look at differential diagnosis and really figure out how to get a solid eval and get to the right result or diagnosis. So I think evals 1 and 2 were definitely my favorite because they were also hands-on. Like I said, we would partner up and we would do evals on each other, or we would be able to use those skills outside of the classroom and go to an athlete or just grab another student and go through some stuff. It's stuff that you could basically work on your own, but also in the classroom setting as well.
Yeah, great, thank you. Derek.
I think my favorite class would probably have to be functional anatomy. Not necessarily just because of the cadaver, but I felt like it really helped me understand. Like I knew when I was doing something, I knew what I was testing, but to see how the muscles lie and see where the ligaments actually are, I feel like it really gave me a better understanding as to how something could get hurt given the mechanism of how the injury happened. I feel like that I find myself going back to the anatomy when I'm doing evaluations a lot of the time.
Yeah, that's great. Thanks, Josh.
Mine's kind of a toss up. It's between functional, because we had the half and half. So it was, you spent like your first morning with the book, and then you got your second book in the lab. So that was where I kind of excelled and where I can open up and I could see it. We got to like cross section of skull and the brain. So that was like an eye opener for me, because it was like you don't normally or will never normally see those things. So to actually have hands on and see where those things lie. And then I think eval 2 with Porter, because I think we were the guinea pigs for the first time they hired a actor that we had to notify them that they were positive for herpes. And it was, I think Porter stood behind the one-way mirror and we had to go in and tell this person, and they would react and be told how to react. And you had to basically on spot tell somebody how they should feel or how they should go about their day. I didn't like it at the time. It was awful, but now seeing that, and you got to tell a kid he may be out for a season or you got something serious going on, but you can navigate that and tell him that it isn't the end of the world. So I think that is probably my favorite part. So that eval 2 was definitely the most frustrating part and definitely embarrassing part at the first time doing it. But I think looking back now, it was probably the best for me at that point. Was like, you're going to have those difficult conversations, so you might as well start now.
And you said they hired actors for that?
I think at that point they hired an actor to react to what the information that you were given, like you were given a Post-it note and said, this patient has blank, and you had to go in and present that to them, and they're like, well, what does that mean? Like, what do you mean on this? And then it was just it was like all improv, and you just had to react, and you were just like graded on it, and it wasn't really, you weren't really sure how to feel at that.
Wow, that's
even as a student. And they got it from, I think, Indiana State at the time, and they were like, oh, let's try it on my group. So then it was like we all definitely didn't feel good about that at the start.
No, I understand that. Yeah, that's tough. Rich, thank you, Josh.
Yeah, I really enjoyed, the majority of them. I'm really big into rehab, really big in evaluation modalities, obviously. But my favorite would probably be functional anatomy. Not so much for the cadaver like we talked about, but learning the arthrokinematics of the joint, the way the joint moves, those types of things on how you basically build the base of your house I feel is anatomy and athletic training, right? If you don't know anatomy, it's hard to do an evaluation. It's hard to do rehab, because if you can't comprehend how the body reacts and what, where structures are attached and how they work together to move. I feel like that's a basis of a great athletic trainer, is good understanding of anatomy and physiology. And with the cadaver, it was just, an added cherry on top, because you're able to see the delicacy of the human body. You're able to see how far that quad muscle is underneath the skin, how many things are innervating that muscle, whether it's the nerve tissue, whether it's artery, vessel. So that was the cool part about it. One of my dissections was the brachial plexus. And I can understand how someone has radiating pain down their arm, because there's so many superficial and deep structures around that brachial plexus that can certainly cause some issues down into your hand, because it runs into a nerve. So those are the things that I really enjoyed about that class.
Great. Yeah. So you get to see like how the body functions.
Yeah. Exactly.
Yeah. Interesting. Matt.
It's hard to pick a favorite. I really enjoyed our block 1 and block 2 classes. So that would be the eval 1 and 2, modalities, the functional anatomy 1 and 2. So two semesters worth of cadaver lab. But the one thing that really stuck out to me, and I think that really benefited me from my perspective now, is the psych of injury class with Dr. Ingram. Had that a little bit later, but it's good to know all this information, but how you interact with athletes with different people is critical. You know, you don't want to come out as a know-it-all, but you need to be able to relate that to just loads of different people, especially in my setting. I don't necessarily deal with always people have a college education, so or come from a good home life or this and that. So just knowing how to interact with people differently and understand from a perspective what they're going through with, you know, psychology, you know, behind an injury, is thought was very, very cool and very good class to have there.
Great, thank you. Casey.
I'd say my favorite would be therapeutic intervention because I was in the um, when it came down to it, I was between acting or therapy. So I really needed the money into interventions. But with the block classes, the really cool stuff, the block classes changed the curriculum a little bit. That was in the works. But they kind of tried to line up like what you're going in eval directly influences and correlates what you're going over in therapeutic intervention and vice versa. So that was really cool. All of your classes together, they all fed off of each other.
No, that's great. All right, Jasmine, favorite clinical experience?
I think I thoroughly enjoy all of them for different reasons. So because they were all fairly diverse. I had football, I worked with track, and then I also worked in, or I also had my last rotation in the like clinical rehab facility that we had. So I think all of them kind of gave me different perspective on different things. So with football, it would be, you know, acute injuries. With track, it would be a lot of the long-term injuries, and then working to create a rehab program in the clinic for the different types of athletes and stuff like that. But I did get a chance to travel a lot with our track team, our men and women's track team. So I think that would probably, if I had to pick, that would probably be my favorite, because that's when I was able to not only see the day-to-day stuff, but I was also able to see the competition stuff, you know, helping them get through that, you know, on the weekends when we would travel with them, making sure I had the right things on the bus, like different things like that, that you don't think about when you're still a student. Just the actual logistical things of what an athletic trainer needs to have for their team when they're traveling. Like the important stuff to have with you directly, like in your seat, or the stuff to have like in the bottom of the bus, you know, in the trunk and stuff like that. And then just being able to respond quickly in the moment. You know, if you have a sprinter that pulls their hamstring, different things like that. So I think that was the most well-rounded experience that I had with the team long-term for a semester.
Great, thank you. Derek.
Yeah, my clinical experience was a little bit different. The COVID lockdown came in during the second part of my first year of the master's program. So I was with field hockey in the fall, and I was supposed to be with track and spring football. I got to go to 2 clinical sessions with the track team, and then we went home for spring break and didn't come back. So I think probably just based off of the timing of everything, my favorite would have to be my full immersion that I did my last semester. It was very interesting to see how like it was a smaller Division III college, and it was interesting to see that different level of athlete. I worked with field hockey at Lock Haven, and I wrestled, so I was used to the upper end of the athletic spectrum. So to go to a Division III school where a lot of the people were not necessarily the best athletes, but they loved playing their sport. It was good to get that kind of experience, and just to see how the athletic training program balanced trying to run games and COVID tracking and all the other things that as athletic trainers, we end up kind of being responsible for because other people don't do it or don't do it correctly. So I think it was interesting to see that broad horizon that I had to encounter down there.
Yeah, and that's something that I forgot to mention earlier. So like when you become an athletic trainer, and if you're working in a high school or college setting, like you have to assume you might be the only person in the school with that skill set, right? So people are looking to you to provide leadership because like that is your specialized set of roles, right? Now again, if you go into a different setting, that might not be the case, but especially if you go, pursue more traditional route, that, again, you're going like all eyes are going to be on you when something happens because you might be the only person that can respond to that. So that's a good point. Yeah, thanks, Derek. Josh.
Clinical, I think, would be my junior year with the girls or women's lacrosse team. That was kind of their height of their performances at Lock Haven. That was like their 3 or 4 year run where they would get second nationally. So I got to travel with my GA to like Millersville for a ranked game at that point. GA being Mackenzie Truitt at the time. I did like a level 2 rotation with them the year before. My junior year was with them. I did a little bit stint my senior year with them. And then eventually I roomed with one of them my GA year because we were both GA. So it was like I got to see women's lacrosse basically for around 3 years of the same people. So it kind of meant, it kind of felt like you always kind of feel like you're a college athlete as this profession because you have to run their same schedules basically. But with that immersion, it was more of like, you felt a little bit more a part of the team as you grew through it the entire years and everybody else with them. So that was kind of a neat experience for me, a little bit unique in that aspect. But yeah, to your question your last statement, yeah, I've been asked a lot of different things in the traditional settings that because you're the only person in the building that would deal with that. Kid falls from the bleachers from the pep rally, tib fracture. They have like pillows wrapped around them and stuff like that. The school nurses don't deal with that often. So it's like you're in the school, they see you could see, somebody passes out, but they won't know from what or when. So I've been asked in some special situations. Very unique things.
Yeah, duty calls for sure.
Oh yeah.
Yeah. Rich.
Yeah, like I said, I had 2 really great sports. I had football and wrestling, so I was able to see a lot of injuries, a lot of contacts, great preceptors with both of them. But I think if I had to pick one, I think I would take wrestling, just based on the nature of the sport, and you never know what you're going to get. In football, like you can assume you're probably going to get some pretty hard collisions. You might get some fractures, some concussions. But in wrestling, it's basically one-on-one versus the other person. You don't know what's going to happen. So you're sitting there and you could have a dislocated ankle the next second, or a dislocated shoulder, like you could have a lot of blood. So I think just the nature of the unknown was something that always interests me, and then the excitement of the sport, sitting in a chair watching a match, cheering on your team. I think that was something that was really rewarding for me. So yeah, I think wrestling would be my favorite.
Matt.
Yeah, I had 3 different ways to look at this. My favorite, the one that was most fun, I think, would be cross country. The team was very good that year. Great group of guys ended up going to nationals, and they were the Atlantic champions that year. Great group of people to work with too. A lot of fun. Most interesting, I would say, probably would be I was men's lacrosse at Lycoming College for a semester. That was a sport I was not familiar with whatsoever, so it was an eye opener to me. Learn a new sport, a lot more contact and collisions happen in that sport than I was aware of. So that was really cool, and to see a different university's perspective of how they handle their athletic training staff. But the one I learned the most during would probably be football. There's just so much going on, and I think that prepared me to handle a day-to-day workload too. There's a lot going on pre-practice, after practice. It's just a lot of stuff moving on. Being able to multitask, that really brought that skill to the forefront in my bag of tricks. So
Yeah.
those three.
Awesome. Great. Thanks. And Casey.
I really enjoyed Sport High School when I was there. Just the different injuries that I could experience, and also firsthand. Actually, on my second day there, we had an emergent injury at the, I think it was a junior high football game, no, varsity football game, and so that was quite the experience right from the get-go. And I believe that was my first clinical experience in the program as well. But also, I really enjoyed working with Dr. who is a chiropractor in town. I was there, I think the rotation was only 2 weeks, but just get those different experiences and the build relationships with other medical professionals to have this professional relationship really go a long way, I found.
No, that's great. So thank you. All right. So I said I started off by saying we might go 30 or 40 minutes. We're clocking in at 60 or 70 minutes, but it was a great conversation. And honestly, we could have easily gone for at least another hour. So again, whether you're watching live or you're watching a recording, we really appreciate you tuning in. If you have any questions, please do not hesitate to contact myself or Dr. Russell. We work for you and we are happy to do so. And thank you everybody who joined us for the panel tonight. I know you gave up an hour or so, an hour and a half of your Tuesday night here to be here. So I really do appreciate that. I know learning more about your careers too. I know how busy you guys are during the day. So again, appreciate you taking time out of your busy schedules to spend it with us. So again, thank you. Look forward to hearing from everybody in the future and have a good night.